That weak urine stream you've been ignoring for the past year? It already killed 3 of my patients before they turned 60. You've probably noticed it. You stand at the toilet and you wait, and then when the stream finally comes, it's thin, it's slow, maybe it stops and starts, and you think, I'm just getting older. That's normal. That thought right there, that one shrug, is costing men their lives. Here's the brutal truth. Prostate cancer is the second most common cancer in men worldwide. According to the American Cancer Society, roughly 1 in 8 men will be diagnosed with it during their lifetime. And the terrifying part? Most men don't feel it coming. They laugh off the earliest sign. They chalk it up to age, to stress, to drinking too much coffee. And by the time they finally walk into a urologist's office, which is usually only after someone forces them, the cancer has already been growing quietly for years. Your body was whispering. You just weren't listening. And that's exactly what we're going to break down today. I'm Dr. Lena, a board-certified urologist with over 10 years of experience. I've evaluated and treated more than 5,000 patients, many of whom came to me with this exact symptom after ignoring it for far too long. If this channel is new to you, subscribe now, because every week I release the conversations your doctor doesn't have time to have with you in a 10-minute appointment. Let's start with the symptom itself and why it's so dangerously easy to dismiss. The number one silent symptom of prostate cancer is a change in your urinary habits. Not pain, not blood, not anything dramatic, just a slow stream, or needing to go more often, or waking up 2-3 times a night to urinate, or feeling like your bladder never fully empties. Sound familiar? Here's the thing: these symptoms don't scream cancer. They whisper inconvenience, and that's exactly what makes them deadly. The prostate gland, a walnut-sized gland that sits directly below your bladder, wraps around the tube that carries urine out of your body. That tube is called the urethra. When the prostate grows either from a benign condition or from cancer, it squeezes that tube. And your stream suffers for it. One of my patients, a 54-year-old contractor, let's call him Marcus, came in because his wife literally dragged him through my door. He'd had a slow stream for 3 years. 3 years. He told me he thought it was just a guy thing. His PSA was 14. That's nearly 3 times the upper limit of normal. He had cancer in 4 of his biopsy cores. But here's where it gets really scary. Here's something that shocks most of my patients when I tell them. A routine physical exam, the kind you get every year, does not automatically screen for prostate cancer. Let me say that again. Going to your doctor for your annual checkup does not mean you are being screened for prostate cancer. Unless your doctor specifically orders a PSA blood test or performs a digital rectal exam, your prostate is simply not being evaluated. The PSA test, which stands for prostate-specific antigen, measures a protein produced by prostate tissue. Elevated levels can indicate cancer, inflammation, or enlargement. It's not perfect, but it is the best early detection tool we currently have. According to data from the Prostate Cancer Foundation, men who are diagnosed at an early localized stage have a nearly 100% 5-year survival rate. Men diagnosed after it spreads to distant organs? That drops to 32%. That gap between nearly 100% and 32% is what a blood test can bridge. A second patient of mine, a 61-year-old retired teacher, had perfect annual physicals for 5 years running. No one ordered a PSA. No one checked. When he finally came in after noticing nighttime urination issues, his cancer had already reached his lymph nodes. And most doctors will never tell you this, but the screening guidelines actually changed in recent years, and the confusion around when to screen is leaving men completely unprotected. There's a specific symptom pattern that I've seen in patient after patient, and it almost always gets blamed on the wrong thing. Nocturia, waking up 2 or more times per night to urinate, is one of the earliest warning signs of prostate enlargement, which can be either benign or cancerous. Most men blame it on drinking water too late, or on getting older, or on stress at work. But here's the medical reality. Nocturia that progressively worsens over months is a physiological signal, not a lifestyle inconvenience. Research published in the Journal of Urology found that men with moderate to severe lower urinary tract symptoms had a significantly higher risk of being diagnosed with clinically significant prostate cancer compared to asymptomatic men. Your body isn't waking you up because you're stressed. Your body is waking you up because something is physically blocking the normal flow of urine, and it's demanding your attention in the only language it knows. One of my patients, a 58-year-old accountant, described it as just poor sleep. His wife noticed it had gone from once a night to 4 times a night over 18 months. She tracked it. She wrote it down. She brought the notes to his appointment. That written log saved his life. His biopsy came back positive. We caught it early. This next part is what shocked even me when I first reviewed the research. There is a dangerous assumption embedded in most men's minds. Prostate cancer is an old man's disease. I'm 45. I don't need to worry about this yet. Let me dismantle that right now. While prostate cancer is most common in men over 65, Black men face a dramatically different risk landscape. According to the American Cancer Society, Black men are 70% more likely to develop prostate cancer than white men and more than twice as likely to die from it. Furthermore, men with a first-degree relative, a father or brother who had prostate cancer, carry double the average risk. If 2 or more first-degree relatives were affected, that risk multiplies again. Family history is not a soft risk factor. It is hard biology. And yet, when I ask new patients whether any male relatives had prostate issues, I get blank stares. They simply don't know, because men in previous generations didn't talk about it. A 47-year-old patient came to me for an unrelated issue. During the intake form, he mentioned his father had died of some kind of cancer when the patient was a teenager. He didn't know what kind. We ran a PSA test. Elevated, significantly. He had early-stage prostate cancer at 47. We treated it successfully. But if he'd walked out that door without that test, if we treated only what he came in for, he would have gone another 5 years without knowing. But here's the part that almost nobody talks about. This 5th point doesn't appear on most health checklists. It doesn't come up in routine physicals, and men almost never bring it up on their own. Erectile dysfunction, the difficulty achieving or maintaining an erection, can, in some cases, be an early signal of prostate-related issues. Not always, not definitively, but the association is real, and it is documented. This is not about embarrassment. This is about your life. The neurovascular bundles, the nerve clusters responsible for erectile function, run directly alongside the prostate. Any significant change in prostate tissue can affect them. Additionally, prostate cancer itself and its treatments can impact sexual function. According to research from European Urology, men who presented with both lower urinary tract symptoms and erectile dysfunction had a meaningfully higher rate of prostate cancer diagnosis than those with urinary symptoms alone. One of my patients, a 62-year-old, came in for what he described as energy issues. After careful history taking, he mentioned, almost as an afterthought, that he'd been experiencing erectile difficulty for about 14 months. He hadn't told anyone, not his wife, not his GP. His PSA was elevated. His biopsy confirmed cancer. He told me afterward, "I didn't think that was related. I thought it was just in my head. It wasn't in his head. It was in his prostate." Let's kill 2 dangerous myths right now. Most people think that if they had prostate cancer, they would feel pain. But the truth is, early-stage prostate cancer causes almost no pain at all. 0. The pain in your back, hips, or pelvis only arrives after the cancer has spread to your bones. By that point, you are no longer dealing with early-stage disease. Pain is a late symptom, not an early warning. Waiting to feel pain before seeing a doctor is like waiting to see smoke before buying a fire extinguisher. The house is already burning. Most people also think the PSA test is so unreliable that there's no point getting it. And yes, it is imperfect. It can be elevated for reasons other than cancer, infection, inflammation, even vigorous cycling. But the truth is, an imperfect screening tool used consistently is infinitely better than no screening at all. The debate over PSA accuracy has, tragically, caused some men to avoid testing entirely. A PSA trend, multiple tests over time showing a rising number, is far more informative than a single result. Your urologist can interpret that trend, but only if you get tested in the first place. Here's what you do with everything you've just learned. 5 steps. Start today. Step 1. Know your baseline PSA right now. If you are a man over 50 or over 40 with a family history, or if you are Black, you need a PSA blood test. Call your doctor today, not next month. Today. A PSA test is a simple blood draw. It takes less than 5 minutes, and it could be the 5 minutes that saves your life. Step 2. Track your urinary symptoms. For the next 2 weeks, pay deliberate attention to your urine stream. Note whether it's slow, interrupted, or incomplete. Note how many times you wake up at night. Write it down. This data is gold when you see your doctor. Don't rely on memory symptoms that gradually worsen, feel normal because the change is slow. Step 3. Tell your doctor your family history and find out what you don't know. Call an older relative. Ask whether any men in your family had prostate cancer, bladder issues, or any urological cancer. This information directly changes your screening timeline. Step 3 is the one most people skip, and it is the most important. Step 4. Don't dismiss sexual health changes. If you've noticed changes in erectile function, reduced libido, or ejaculatory changes, mention it to your doctor. Every detail matters. No symptom is too embarrassing to discuss with a urologist. We have heard everything. Step 5. Establish a relationship with a urologist before you need one urgently. Your primary care doctor is wonderful, but prostate health has nuances that benefit from specialist attention. A single preventive urology visit can set up your baseline and map your long-term monitoring plan. And if you are experiencing any of the symptoms we discussed, slow stream, frequent nighttime urination, urinary urgency, incomplete emptying, do not wait. That is already your signal to make the call. Before I go, there is one more thing about prostate cancer that almost nobody in the general public knows. And once you hear this, you will never look at this topic the same way. Ready? Some prostate cancers grow so slowly that men who have it will die of something entirely unrelated, never knowing the cancer was there. But other forms are ferociously aggressive. They double in size in weeks, not years. The terrifying challenge of prostate cancer is that, from the outside, from the symptom perspective, you cannot tell which kind you have without testing. Slow-moving or fast-moving, the urinary symptoms look the same. The PSA can look the same. The only thing that separates a watchful waiting strategy from an emergency treatment protocol is a biopsy, a Gleason score, and a specialist who knows what they're looking at. This is not a disease where you can trust your gut. Your gut will tell you you're fine. Your biopsy tells the truth. 3 things I need you to remember from today. 1. A weak urine stream, frequent nighttime urination, and urinary urgency are not normal aging. They are your prostate asking for attention. 2. Prostate cancer causes no pain in its early, most treatable stages. Pain means it has already spread. Get screened before you hurt. 3. A PSA test is a 5-minute blood draw that can be the difference between a nearly 100% survival rate and a 32% one. The math is that simple. Subscribe to this channel because every week I release the medical conversations your doctor simply doesn't have time for in a standard appointment. And if what you heard today surprised you, you absolutely need to watch this video next.